My name's Kerry Nelson, so I'm a general practice dentist in San Antonio, Texas, and I have been with MB2 now for about a year and a half, and I got into dentistry about 20 years ago, so I've been practicing for 20 years all in the San Antonio area. I first heard about MB2 from a student of ours that I was following up with from UT, who brought up the MB2 model, and I didn't really know what it was, so I just put out a search and connected with Gabe Shawan, one of the longtime doctors at MB2, and had a great, I think it was about a 2-hour conversation with him about the ins and outs of dentistry and the dental space and where things are starting to go with the dental space. I've never heard of this type of hybrid model where I can still be a doctor owner and have autonomy to practice the way that I want, but I had really not heard of this type of model where I could also have the support of a large organization. So I thought I was starting to lose our competitive advantage to the many corporate shops that were opening around us and on our street, and thought I needed to gain an edge, and I needed to find the best possible people that I could partner with, and that's how I found MB2. So as I started looking at MB2 specifically and started to really dive in and get involved with these guys, I've really enjoyed the operational support that we've had. We've got a great team on the ground, boots on the ground inside the practice. Not to mention what we get from Dallas. So from Dallas, we're using the IT, the procurement team, the legal department, the ordering. We're using accounts receivable. Just a lot of products and things that they have that support us in a way that we just never had the option for before. I talk to a lot of doctors across the country, and one of the overwhelming things that I hear is that people are overwhelmed. You know, people are burnt out, their backs hurt. Often it's the management burden that people struggle with. And when you've done this for a long time, like I have, I think that we, as a dental profession, have really started to need help. You can't be everything and you can't wear every hat. And so what this has provided for me is the ability to step back, allow some of that management to be handled by other people, where I'm not having to know every aspect of every single day and feel responsible and feel that burden on my back at all times. So the management support's been great, and I've really enjoyed having a whole added layer of support. So now I'm a year and a half, almost 2 years into this, and I decided to take on a second practice. And so this is a practice that I think I never would have even considered before MB2, but having their support and having the ability to tap into the many services that they provide has been great. The challenge with now a second practice and 2 large practices is really trying to figure out how to split my time. I'm still working chairside, still coming into the new practice and finding exactly where my footing is going to be with that, being a new kid on the block for the first time in almost 20 years, which is very different. But I think that we've got a great operational plan. We've got a great strategy for how we can implement new things, but take the things that they're doing really well and use those to try to coalesce a really great product where we can serve a lot of patients. So doctors, I know that this is a very different time in our world with COVID, with the practices that are around you. I know that docs are tired. I know that there's just a lot of responsibility, and there's a big burden. I think that MB2 solves a very large problem, and that is that if you are a successful practice, if your practice has grown to a certain level, there are not a lot of buyers that you would consider partnering with. And I think that MB2 fills that void by allowing you to be a doctor owner. It allows you to still call the shots. It gives you autonomy with a ton of support. And I think it's a very unique thing. You don't have, when you become successful and your practice grows to a certain level, there just aren't a lot of young docs that can afford to buy that practice. And I think that that's the void that MB2 can fill, where you don't have to sell out to another ownership group where you might not have any say. So you might actually have a lot of your practice dictated to you by a regional manager or by somebody that does not appreciate the blood, sweat, and tears that you put into your practice. So with MD2 comes a great link where you can actually still practice, you can still do the things that you want, but get the support that you need so that your every hour outside of the practice is not revolving around the managerial duties that you right now might be having to deal with. So I'm 47 now, got these 2 great practices, really looking for ways we can maximize our potential in each, looking for some strategies for growth for both. We're adding in some specialty services, things that we just did not have the ability to offer to our patients before. Really excited about the next decade of being able to ride this wave, make our practices just absolutely as successful as possible. We've already grown a ton, which I didn't think was possible, but we found ways through some really interesting logistics and strategies and operations, and really proud of what we've done in just this year and a half, and can't wait to see what we might be able to do in the next decade. So hopefully after another decade or so, I'll be ready to fish and hunt and do whatever else is out there.